Ready?
Am I on? Okay. So, good morning, good afternoon, good evening, depending on where you are in the world, and welcome to this presentation on the Buteyko Method. My name is Christopher Drake. I have been teaching the Buteyko Method for over 2 decades, and I believe I've taught around 20,000 or so students the Buteyko Method, and I'm take this as a privilege, the opportunity to explain to you the idea behind the Buteyko Method. I remember when I first heard about the Buteyko Method, and it was told to me that this method could treat all kinds of diseases. And I understood that it was a breathing technique, and I could not believe, in fact, I thought it was a lot of rubbish. How could you treat diabetes with the breathing? Or how could you treat cardiovascular disorders with the breathing method? It did make sense that maybe you could promote relaxation, or some sort of meditation type idea, or something to make you feel a little better. But I could not understand how possibly a breathing method could solve or reverse chronic disease, diverse chronic diseases. But I met a chap by the name of Alexander Stalmatsky. He was Professor Buteyko's protege, and he came to Australia. Back in those days, I was actively engaged in operating medical centers, medical clinics, and so forth. And he was a Russian migrant who I thought was very interesting. I didn't really take his ideas seriously, but I did try to organize a few patients for him. Just relaxation, some sort of, nice therapeutic breathing method. But to my surprise, the feedback that I got was people were having their asthma solved out, their high blood pressure, their angina, their diabetes mellitus, and other serious conditions. Well, the reason for all this is, or the reason for my underestimating Buteyko Method, and I guess the reason why most people might quite understandably be cynical as to how a breathing method could treat what seemed to be unrelated diseases. And that's because they're not fully aware, as I wasn't, of what the breathing does. I was under the impression, as most people are, that the purpose of breathing actually is to get oxygen, and it is. We breathe so that our bodies can receive the vital oxygen. I was not aware that the way we breathe also determines the level of carbon dioxide within the organism. I was under the impression, as most people were, and many still are, that carbon dioxide is a waste product. But this is actually not true. Carbon dioxide is essential for the human organism to function properly. Carbon dioxide determines the rate at which oxygen comes off the hemoglobin and makes its way to cells and tissue. Carbon dioxide determines the aperture of all vessels, blood vessels, brain vessels, bronchivessels, and so forth. Carbon dioxide determines the rate at which the antibody bonds to the antigen and thus forms what's called our immune system. It is carbon dioxide in which the threshold of its level determines the excitability of the nervous system. And carbon dioxide in the form of carbonic acid, which determines what is known as potential hydrogen in the body, or pH, so the so-called acid-alkali balance. So carbon dioxide is not something which is a waste product, although Al Gore might tell you it's a terrible polluting substance. In fact, carbon dioxide is the genesis of all organic life. And what Professor Buteyko discovered, and I will talk a little bit about Professor Buteyko in a moment, what Professor Buteyko discovered was that these people, this group of people who suffer with chronic disease, back then it was called, the category was called the diseases of civilization. These days we don't call it the diseases of civilization. We call this category of diseases chronic diseases: asthma, allergies, angina, bronchitis, bronchiectasis, cystic fibrosis, diabetes mellitus, emphysema, hormonal disorders, obesity. There are some sleep apnea, snoring, insomnia. There are some 200 diseases which are in the category of chronic disease. And these diseases used to be called the diseases of civilization. And Professor Buteyko, who was an academician in the former Soviet Union, did a vast amount of research and reached the conclusion that people who suffer chronic disease, or as he called it back in those days, some more than 5 decades ago, nearly 6 decades ago, the diseases of civilization all share one thing. They all have a lower than optimal level of carbon dioxide in their organism. They all have a deficiency of carbon dioxide. Now here comes the paradox. The level of carbon dioxide in the air that in our environment is around 0.035%. This is not a controversial claim. It's what everyone understands to be the case. 0.035%. The optimal level of carbon dioxide within the human organism is around 7%, which means we should be 200 times richer in carbon dioxide than our environment. And if we have the tendency to overbreathe or to hyperventilate or to breathe above what is recommended in medical textbooks, by the way, the effect will be to lose this precious carbon dioxide, this substance which determines oxygen uptake, carbon dioxide which determines the aperture of all vessels, which should be of interest to asthmatics and people who suffer with migraine and so forth. Carbon dioxide, which determines the rate at which the antibody bonds to the antigen. Those of us who suffer constant colds and flus and infections and so forth. So, and if we look at the pH now, there would be, more than a dozen separate conditions which arise out of a disturbance to the pH. And poor people are trying to change their diet and do everything to change their pH because many people are aware that a disturbance to the potential hydrogen causes all kinds of problems, but little do they know the main buffer, the thing which exerts the most influence on a person's potential hydrogen or pH is in fact carbonic acid, which is another form of carbon dioxide. So what Konstantin Pavlovich Buteyko discovered was that the diseases of civilization are caused through chronic hyperventilation. And let's just go back for a moment and discuss this point. We've got hyperventilation. 2 words, hyperventilation. Hyper just means too much. Ventilation is indicative of respiration or breathing. So hyperventilation is just breathing too much. But the term hyperventilation is normally reserved for episodes of acute hyperventilation, such as when somebody has a trauma or is poisoned or has some terrible injury or some shock, anaphylactic shock, for example. They begin to dramatically and acutely hyperventilate. We're not talking about acute hyperventilation. We're talking about chronic hyperventilation, which is much more insidious because it's invisible. It's not noticeable. Now, if we were to do business between each other, and in each transaction you were to lose 1 penny, it wouldn't make much difference to you, because the only thing that you can buy with a penny is another penny. If, however, we were doing 20 to 30,000 transactions a day, and on each transaction you are losing a penny, it doesn't take a mathematical genius to understand the accumulative effect over days, weeks, months, and years will spell financial ruin just because you're losing a penny. If you overbreathe, if you chronically hyperventilate, constantly, habitually, unnoticeably, if you breathe above what is the physiologically recommended norm for ventilation, you will lose carbon dioxide. As a consequence, according to your genetic predisposition, your body will attempt to defend or compensate for this loss of CO2, and therefore these diseases of civilization will arise. Now, I think looking at them as the diseases of civilization is much more revealing than the category name chronic disease, because they were called the diseases of civilization probably up to several hundred years ago, because doctors noticed that the more civilized the people were, the more prone they were to these kinds of diseases. So there's something about living a civilized life that causes us to chronically hyperventilate. And Professor Buteyko became obsessed about his method of retraining the breathing pattern and reversing these diseases, not just because he thought it was very useful and a very great discovery, which it was and is, but more so because he realized that the habitual chronic hyperventilation is getting worse. It is something which is becoming more and more prevalent. And so he was quite obsessed, and he believed that when the human being's when contemporary man's breathing reached a certain point of chronic hyperventilation syndrome, that society itself would collapse, because so many people would be ill and stupid and violent and crazy and sick and everything else, that society would collapse. And he thought this was something that the medical authorities and the governments and people in charge should take very seriously. Unfortunately, they didn't take it seriously, and to this day they still don't take it seriously. A little about Professor Buteyko. He was not a regular Soviet medical doctor. A regular Soviet medical doctor would have the equivalent military rank of a second lieutenant. A doctor, perhaps, who managed or governed a large hospital may have the rank of captain. Professor Buteyko was an academician, which is a very high scientific rank, and that would have the equivalency of a 3-star general. So he was no ordinary medical doctor. He was considered by Soviet scientific authorities to be a great scientist, an important scientist. And he was awarded this this title, this position, this great scientific accolade of great stature because of research work he did in cardiovascular disease and his speciality of high altitude flying. So he was a very serious and a very well respected, highly regarded medical scientist, not just, and we have nothing against regular family doctors, but he wasn't in this category. He was not a regular family doctor like a GP or someone like that. He was actually a rather august figure who was a medical scientist. He was able, because of his authority and position, to draw down the resources and to have a team of people who made very serious inquiries as to what delineates those people who have chronic diseases or diseases of civilization and those who do not. And what he found was it was the indigenous level of carbon dioxide. And the level of carbon dioxide is governed by the way that we ventilate. If we overventilate, we will lose carbon dioxide, and as a consequence, the organism will have a deficiency. And because of this deficiency, and according to your genetic predisposition, the appropriate defense mechanism or disease, according to laws of biology and genetics and whatever predispositions, will arise accordingly. Some people who chronically hyperventilate develop asthma. Other people who chronically hyperventilate develop migraine headaches. Others who chronically hyperventilate develop bronchiectasis or cystic fibrosis or lupus or multiple sclerosis or allergies or obesity or bipolar, schizophrenia, scoliosis, even arthritis at its genesis is caused by a disturbance to the pH, which is brought about by a deficiency of carbonic acid or carbon dioxide. The net result is that in order to balance the potential hydrogen, what's it called now? The material that bones are made of. What's that? Anyway, bones are stripped of their calcium. Sorry, a senior moment there. Calcium is stripped off bones in order to change the pH, and then it reforms in calcified deposits on the joints. As a consequence, joints come out of alignment. Then there's inflammation, and now we have what is known as arthritis, which basically is the same principal problem behind plaque on the teeth. It's also a calcified deposit, gallstones, kidney stones, even Alzheimer's. I mean, how could you link Alzheimer's disease with arthritis? They are both calcified deposits. For some people, it calcifies and forms deposits in the joints, and for other people, it calcifies and forms some unwanted material in the prostate or in the kidneys causing kidney stones, or in the gall ducts causing gallstones, or even in the teeth, what dentists call plaque. So Professor Buteyko's idea is a big idea, a very important and monumental discovery. But as civilization moves on and the qualities of our contemporary life take us as they do, for some reason, for multifactorial reasons I'm sure, we have the tendency to breathe increasingly deeply and overventilate, lose our carbon dioxide, and as a consequence develop all kinds of chronic ailments. At this point, I will mention the following, that you should all find it interesting that we've had these diseases like asthma, allergies, angina, high blood pressure, diabetes mellitus, emphysema, COPD. We've had these diseases for many, many years. But did you know that there's no explanation for them? No official explanation. The medical world has no explanation for asthma. These millions and millions of dollars have been poured into asthma research, scientists tinkering away with their chemicals and laboratories and microscopes and research and investigation, and the official explanation for the cause of asthma, don't know. They say things like pollution and cigarette smoking and so forth, but we find that the cleaner, more advanced countries have a higher incidence of fatal asthma than poorer third world and more polluted countries. So whilst we're not saying that pollution is a good thing, what we are saying is that pollution is not the real underlying story behind what is the cause of asthma, for example. And so it goes with all these diseases. Genetic predisposition, formerly called eugenics and now genetics and so forth, they can see that you have a predisposition to asthma or allergies or whatever marker you have. But if they were to check everybody, they would find, and they do when they do broad spectrum testing, that many people have the marker for a particular disease but don't actually have that disease. And so how could this be explained? It's obviously the fact that a cofactor is required so that you may be genetically predisposed to have asthma or allergies or angina or diabetes, whatever, but you need a cofactor for that genetic predisposition to be realized or to be actualized. And that cofactor would be a deficiency of carbon dioxide. So I would invite everybody, if they have any questions about the Buteyko method, to ask any questions, and I'll make some attempt to answer them. No questions yet? Okay. Well, it may be interesting then for everyone watching to learn Buteyko's test, how to measure the breathing. And measuring the breathing is measuring the idea of what's called the control pause is to measure the sensitivity of the respiratory center. The respiratory center is located in the medulla oblongata part of the brain. And what happens is, this is why you breathe. You're not actually sensitive to oxygen. You need oxygen. It's an essential food. But what drives your breathing is not your demand for oxygen. For example, if I were, through some technical means, able to remove the oxygen from the environment in which you are presently sitting, you would not feel any great urge to breathe more. You would not necessarily feel suffocated or any lack of oxygen per se. And that's because you don't actually have any sensitivity to oxygen, or very little sensitivity. So what would happen, in fact, is that you would probably get sleepy and tired, and of course, if there was a deficiency in oxygen, you would die. But you would not be gasping to try to get more air, to sort of get more oxygen, because you simply don't have your breathing pattern isn't driven by your sensitivity to oxygen. Your breathing pattern, or your involuntary urge to breathe, however, is driven by your sensitivity to carbon dioxide, or at least the respiratory center's sensitivity to carbon dioxide. And when the level of carbon dioxide reaches a certain point, when you stop breathing, the carbon dioxide increases. When it reaches about 6.5% in the alveoli, it sends a trigger to the respiratory center. And if you don't ventilate and lose this CO2, you will feel the respiratory center will trigger a sensation of air hunger or suffocation. It will also stimulate the vagus nerve system, so quite involuntarily you will feel the urge to breathe. So by testing and checking the respiratory center, you can actually find out how you breathe. Do you breathe perfectly fine and therefore do not require any attention to your breathing? Or is in fact your breathing a problem? Or could your breathing pattern be the cause of certain symptoms and health problems that you suffer? The Buteyko's control pause can give you a strong indication of that. It's very simple to do. All you have to do is make a normal breath. Don't do it now, just watch me first and then we can do it later. All you have to do is take a breath in, normal breath in through the nose, small breath in, and a small breath out. That's a normal breath in, a normal breath out, and then hold your breath. And whilst you're holding your breath, you're counting the seconds that transpire. So you make a breath in, you make a breath out, you hold your breath, and then you hold your breath and count the seconds until at a certain point you feel the urge to breathe. At this point, you release your nose and check how many seconds transpired. Now, some of you will be able to easily hold your breath for 10 seconds. Some of you can hold it for 20 or 30 or 50 or 60 or whatever seconds it is without having any great urge to breathe. So if you like, we can do it now. This is called Buteyko's control pause. It measures the sensitivity of your respiratory center, and it can tell you how much you ventilate or breathe, and from this and we can make a subsequent calculation and determine if you're going to be CO2 deficient or not. So let's try this together now. So just relax first, look at me. So let's make a breath in and a breath out and hold 3 seconds, 5 seconds, 9, 10 seconds, 12, 13, 15. You should only hold until the first difficulty. 19, 20 seconds. 24, 25, 30 seconds. 4, 35, 36, 40 seconds, 43, 45, 50 seconds, 53, 54, 55, 59 seconds, 60 seconds. So, if you had to gasp after holding your breath, it means that you held on for too long. Remember with the control pause, and you can do it again later. Make a breath in, normal breath in, make a normal breath out, not a full evacuation, just a breath in, breath out, and hold. Count the seconds until the first difficulty, the first urge to breathe. And you let go, and you see how many seconds you made. Now, we're going to see if we can get this camera open. Can you see it? Is it all right? Okay. So if your control pause, CP, was 60 seconds, if your control pause was 60 seconds, it means that you breathe 3 to 4 liters per minute, and that your breathing is perfect. Your breathing is the same as blood pressure 120/80, or a pulse of 60, or a body temperature of 98.6, or whatever. You will not have asthma, you will not have allergies, you will not have Crohn's disease, autoimmune problems, migraine headaches, obesity, insomnia, sleep apnea, schizophrenia, bipolar, scoliosis, or any of these chronic diseases. If your control pause was 30 seconds, it would mean that you breathe on average 6 to 8 liters per minute. In other words, you breathe for 2 people. You breathe twice as much as you should. Now, you won't have many serious problems. Your health, you will not be facing any kind of a trauma. Eventually, as age comes along and one thing and the other, your health will deteriorate, obviously, like it usually does with age and so forth. But generally speaking, you'll be in reasonable shape if you have a control pause of 30. Not perfect, it's not ideal, but it's certainly not nothing to panic about. If your control pause is 20 seconds, it means that you breathe approximately for 3 people. You breathe 3 times more than what is recommended in medical textbooks. Your organism is losing lots of carbon dioxide, and continuously. And you will have health problems or some defense and compensation mechanisms. Sometimes they're in the way of asthma or allergies. Sometimes there's no sign of any health problems, and all of a sudden they come in some sort of sudden trauma or whatever. But generally speaking, the control pause of 20 is not a great sign. If your control pause is 10 seconds, it means that you breathe approximately 6 times more than what is optimal. And you know that you've got health problems. You'll be in no doubt. You will not be in any way, you will not require any convincing that your health is nowhere near optimal. And if your control pause is below 10 seconds, your situation is not sustainable. This is physiology. If you go to a hospital and you see the newborn baby, you will see that their breathing is virtually imperceptible. They breathe so slight, so shallow, and so light that mothers often think, and in quite a panic, I guess, that their baby has stopped. They haven't stopped. They're breathing absolutely healthy, and that's why very young babies, brand new babies, don't suffer with the Crohn's disease or with asthma or allergies or these sorts of diseases of civilization, unless, of course, the mother was in a very high state of hyperventilation and passed it on to the child. But generally speaking, and these little babies can hold their breath for 2 minutes or so without any problem. If then you transfer to the ward for the terminally ill, you will see people flat on their back with the mouth open, the chest heaving, oxygen being pumped in, and the ventilation is enormous, and they are losing lots of carbon dioxide. And for those of you who are familiar with death, you would know that it comes with a Cheyne-Stokes evacuative breathing, enormous heaving of breath and so forth, because at the time of death the body goes completely alkaline as the CO2 is discharged and the organism stops being alive. So the whole point of the Buteyko method, the whole idea behind it, the reason for it, is to increase your control pause, to improve your control pause, to improve your breathing. And this is why Professor Buteyko was so obsessive, because when he made his discovery, the average control pause was around 30 or 35, maybe a little higher sometimes. 40 years later, or 20 years ago, when I started working with my teacher, we were seeing average control pause around 25, 28, 22, 23, depending on, individuals would vary, but the control pause back in those days was generally over 20. And these days, we see control pause, commonly we see 12, 15, so forth and so on. So we see a fairly dramatic a decline in the control pauses, and this decline in the control pause correlates with the increase in asthma, diabetes, obesity, stupidity, violence, you know, all the diseases of a civilization. So that's what Buteyko Method is about. It's to retrain your respiratory center so that your breathing comports to the physiological norm, roughly 3 to 4 liters a minute. And if that is in place, these chronic diseases reverse, because the need for them is no longer in existence. The sufficiency of carbon dioxide will ensure that the organism, or that department of the organism, works properly. I think some people have asked some questions, so I will quickly look at them and I will try hopefully to answer them. Emily writes, "Hi, I have been enjoying the webinars. Is the intensification of breathing during early hours of the morning due to a function of circadian rhythm or dependent on the number of hours that a person has been asleep? Also, are you going to be running online 5 to 10-day courses in February and March?" Okay, so, right. When Lord Buddha was asked how many hours, because they asked Lord Buddha everything. They asked him, how many hours should a person sleep? And he said the normal amount, 3 to 4 hours a day. Back those days, many hundreds of years ago, most people slept for 3 or 4 hours. And most people had a control pause around 40, 50, and 60. Patanjali, the man who, well, he wasn't specifically a rishi, but he was the man, you might say, who codified yoga. And he basically said that a person who can't hold their breath for 2 minutes was not in good enough health to do standard asanas and yoga. 2 minutes. Because that was the norm in those days. So we are seeing, as the hyperventilation has increased, people's requirement for sleep has also increased. I'm sure the circadian rhythms have something to do with it. But in areas which I'm not sure or I don't know, I rather not make any remark, because I don't know what I'm talking about. So I can't make a proper remark with respect to circadian rhythms. I know what most people know about them, which is not very much probably. But I do know that most hospitals receive most of their asthma patients, stroke casualties, and myocardial infarction casualties between the hours of 3 a.m. and 6 a.m. And this is because we know that breathing becomes the deepest in these early hours of the morning. Now, why is that the case? Is it the case if a person's working shift work, or is it because they're sleeping too much, or whatever? Well, the permutations now become, difficult to isolate. But we know for sure that on average, most trauma occurs between the hours of 3 and 6. Snoring, nightmares, stroke, heart attack, fatal asthma attack, and so forth. Therefore, we know that breathing is the deepest in those hours. So to answer I'm not sure, is it Lily? Emily, that I answered your question properly, but I hope that I sort of covered the area a little bit. We know that people, the longer the sleep, the deeper the breathing, and we know that most of this trauma occurs when the breathing is at its deepest. You don't see a chap snoring as he's pushing a shopping trolley down an aisle at Tesco, but he does snore when he's at in the deepest part of his sleep around 3 a.m. And so the hospitals can provide the evidence of trauma and the deep breathing which occurs in the middle of the early hours of the morning. I hope that was helpful. Gigi, I'm on a good downward trend in systolic, I presume. Previously been on a plateau with some cleansing. I've been to 2 workshops in Brighton. Do I have to pay for an online workshop? This is a presentation, Gigi. So I'm sure we can sort you out in a workshop, online workshop, and Martha or maybe Vladimir can follow you up to improve your situation. But this is a presentation, so I can't really comment too precisely. And you don't mention what is your control pause and so forth. But I'll make sure, Gigi, that either Martha or Vladimir is in touch with you to put your practice back on track. And I'm sure we can squeeze you into an online workshop somewhere. So you're in Brighton. So I think we're actually having a workshop in Brighton, but also we're doing online, so you can take your pick. It was the case that anybody who attended one of our bricks and mortar workshops can do any refresher at no extra charge. So I see no reason why you can't join an online workshop again if you want to sort of augment your practice. Paula writes, a question from my neighbor who is here. He's got hypertension and vascular problems and rhinitis and some muscle problems. How to get started to solve these problems, and is climate a factor in these conditions? Well, Buteyko Method requires that you understand the idea, that you can follow instructions, and that you're willing to be coached and practiced. And the idea is to change your respiratory center's sensitivity to CO2. It's not just how to breathe properly, because even if you were able to, the moment that you lost your concentration on doing so, your breath would rebound to its previous homeostasis. So the idea of Buteyko Method, and by the way, Professor Buteyko tried medications, pharmaceutical approach, various contraptions, breathing masks, and all kinds of things to try to normalize the level of CO2. The problem is, as soon as the medications wore off, I think he used morphine and various things. As soon as the medications wore off, or as soon as you detached yourself from the device or whatever, the breathing pattern would return to normal. And that's because the respiratory center has a homeostasis, a certain homeostasis, and that needs to be changed. That needs to be retrained or reconditioned so that your breathing, when you're conscious, when you're unconscious, when you're asleep, when you're working, when you're exercising or whatever, is different. And Paula, all the symptoms that are of concern to your neighbor, the rhinitis, vascular hypertension, all this is all classical diseases of chronic hyperventilation syndrome. You also mentioned muscle problems. Well, muscle problems are included, but not all kinds of muscle problems. But I would imagine, given that there is issues of rhinitis and cardiovascular hypertension and so forth, that the person definitely has chronic hyperventilation syndrome. They can do a control pause and they can see for themselves. My guess is their control pause will be well under 20. And we do have a workshop. When is the workshop, Abner?
20th of January.
Yeah, we have a workshop starting on the 20th of January. It's a 5 to 10 day workshop. People can come for 5 days, and if they need or want more coaching, they can stay for another 5 days. The reason why we do this is because sometimes we have someone who has fairly not much work to do really, and they can manage to solve and improve their condition to a satisfactory degree within 5 days. And other people who, with more serious conditions, lupus or multiple sclerosis or deeper diseases and much lower control pauses, they may want additional coaching and help and coaching and so forth. You don't really have to make up your mind if you want 5 days or 10 days. I would recommend that if you are insulin dependent diabetes type 2, or you have lupus or multiple sclerosis or COPD or very severe brittle asthma, that you opt for the 10 days. If you just want to get started and see if the method is effective for you, I would just try 5 days. And 5 days may well be enough. But most certainly, regardless if your condition is very mild or very severe, within 5 days, you'll see significant improvement. You will see a linear comparison, or a linear, what's the word? You'll see a linear relationship between your control pause and your symptoms. As your control pause improves through changing your breathing pattern, so your symptoms will become less. Now, you won't solve lupus or multiple sclerosis or any of these serious conditions in 5 days, but you can make significant, incontrovertible, obvious improvements. For many people, 5 days is not enough. They would like more coaching, more practice, more skills to get the result they need. But for many other people, 5 days is quite adequate, at least to get started, at least to get the results which they're looking for. So I hope I answered your questions, Emily. Oh, CP of 12. Well, yeah. Cora writes, very interesting webinar. Thank you. Just a quick question. Body acid-alkali balance. Dr. Robert O. Young shows in his books that we are very much prone to acidity, not alkalinity. Links it mostly to diet, though. What is the correlation between this and the alkalinity that Buteyko proposes as cause of disease? I'm really I was going to say upset, but that's not the right word. I'm not really upset. But you cannot describe the human organism as having a certain acid or alkaline characteristic, because the acidosis and alkalosis needs to coexist, and there is what's called a shunt mechanism. The meaning of pH is potential hydrogen. The characteristics of it are this acidosis or alkalosis. So you should have a comparative metabolic alkalosis and respiratory acidosis. And when people speak of acid or alkaline, where are they measuring it? Are they checking the arterial blood or venal blood or tissue? It's too simple to say that we need to be more alkaline or we need to be more acid, because there's actually a shunt between the two. I think it was Einstein who said that things should be made as simple as possible, but not one bit more simple than is necessary to understand the problem. Now, this idea that you're too acid or you're too alkaline is a grotesque oversimplification of the role of hydrogen in the human organism, or at least of potential hydrogen. And because they're measuring in arterial blood, but then venal blood might compensate, and you have a metabolism, but then you have a respiratory system and so forth, and they all have different, they should all have a different pH. You're not like a glass of water in which the pH should be a fixed amount. And to think so is, well, just plain wrong. It becomes some sort of gimmick. And the main buffer of the pH in the human organism is carbonic acid. That's not controversial. This is physiology. This is a basic, well understood, um, scientific, medically accepted scientific concept. And to think that you could influence this with diet, well, you can, but not by much, and not over a sustained period. So if you're hyperventilating, blowing off lots of CO2, and thus diluting your levels of carbonic acid, you're not going to compensate that by eating blueberries or something. You know, it's not going to happen, because your ventilation is going 20 to 30,000 times a day, and your levels of carbonic acid are way more influential than anything that you might eat or might not eat. Allow me to give a very simple example of that. If you stop eating completely, you will live for a month. Most people, if they're in reasonable health, will live for 2 months. If you stop breathing, you're dead in just a few minutes. And thus you can make the comparison between diet, which of course is important because of the accumulative effect and poisons and digestion and so forth, but you can't compare the metabolic reactions between diet and breathing. One is an absolute giant with enormous persistent influence, and the other, by comparison, is a very lightweight thing. I'm not suggesting for a moment that you should be casual about your diet or that you shouldn't take care of your diet, but in comparison to breathing, it's not. I mean, for example, they have all these diets for various diseases. As far as I know, unless it's a digestion issue, but none of these chronic diseases get solved by diet. Maybe fasting might help, but fasting has the tendency to reduce the breathing. So once again, perhaps the lack of food would have a greater influence on the organism than whatever food you might choose for its nutritional value. That's what Buteyko would say, at least. I hope that's helpful, Paula. Oh, sorry, Cora. I hope that's interesting, Cora. Emily writes, on what medical conditions she has various circulatory problems, recent years have had problems focusing, fatigue, joint problems. These are all diseases of civilization. These are all hyperventilation diseases. And check your control pause. I think you mentioned earlier it was 12. Well, then you should expect these kinds of problems. And as your control pause improves, if you practice a breath holding, you follow Buteyko's ideas, lifestyle changes, and breathing exercises, which are quite a bit of work, actually. This is unlike a lot of health advice that you should take, you know, the bark of the goo tree, or some sort of, you know, healthy you know, stop smoking or don't eat hamburgers, or this is nothing like that. This is actually hard, laborious, persistent work where you have to do exercises 3 or 4 times a day. You have to practice breath holding. You have to have certain dietary rules, at least temporarily, and you have to be quite obsessive with the practice. And if you are, and your control pause improves, you will see a linear result with your symptoms. It's much like walking. The principle of walking from one place to another is the same. It doesn't matter if your destination is 10 miles away, 5 miles away, or 50 miles away. If you're walking in the right direction, you're moving toward your destination. Some people, small children with very mild asthma, they don't have far to go. Within a few days, all their symptoms are rapidly coming off. An older person with 3 or 4 chronic diseases, on medications, toxic, overweight, bit crazy, you know, stressed out and so forth, they have a lot further to go, a lot more work to do. I mean, it's just like anything else, really. But the great thing is that this is something that when you learn it and you become skillful and you practice and you become, you know, good self-confidence, not based on some artificial confidence, but confidence based upon the skill set which you have been taught and coached, and you've developed your way around how to do things. You can exert tremendous influence over your own health, and you can avoid all this, you know, crazy, you know, doctors, toxic medications, trauma, hospitals, and all the unnecessary misery. And it's quite unnecessary. I mean, you know, to have this asthma, allergies, angina, and aching joints, and obesity, and all these insomnia, and nervous conditions, and so forth. Quite, it's something you can do without. But you, because of the pressures, perhaps the pollution, environment, stress, society, whatever, we have found ourselves in the situation that we're in. And Buteyko Method is a great way. I will just say it one more time. Don't make the mistake to think it's easy. It's not easy. It is work, and you should be committed to doing work. You don't require faith. It doesn't require belief. It doesn't require a positive attitude, but it does require the work to be done. Whether you are a bright, optimistic person or you're a misery guts, it doesn't make any difference. Your control pauses improve, your levels of CO2 improve, the laws of nature will take care of the rest, and for those conditions which are related to a deficiency of CO2 will be reversed. More questions I'll try to answer. I think that's all. You're very welcome, Emily, and you're also welcome, Cora. I think we've come to our conclusion. I'd like to thank everybody for taking time to attend this presentation. I'm not, obviously I'm very happy if people enroll in our workshop, which I believe starts on the 20th of, I'll be conducting an online workshop starting on the 20th of December. No, January, sorry. But if you are not sure, or you want to become more, get a more explanation, I would highly recommend that you go to our website, look at the material, look at the testimonials before you sign up for a workshop. Make an appointment to speak to a practitioner and get a good understanding of what you're getting yourself into, so that you can go into it with your eyes open and that you can do it properly. I wouldn't necessarily recommend that you just sort of, you know, on a whim say, oh, I think I'll learn the Buteyko Method, because it's like learning golf or learning karate or learning any other kind of skill. It requires work, commitment. You should be in the mood for it, and you should be ready to learn, because if you don't have an intellectual understanding of what we are doing, you will not have the will or the inclination to do those things which would otherwise seem what's the word? Counterintuitive. Because this method seems counterintuitive. People with COPD and with asthma and bronchiectasis, they want to breathe more. They think their problem is that they're not getting enough air. But the fact is they are overventilating. So it's a very counterintuitive idea for them to practice this. But after a couple of days, when the mucus of bronchiectasis starts to come off, and when the asthma spasms begin to become less and less frequent and less severe, and when the breathlessness of COPD and emphysema is noticeably less, then it starts to make sense. And that takes a few days of practice. But you have to be quite, you know, sincere in your practice. As I said, you don't require faith, doesn't require belief or confidence or a good attitude. It just requires the work, which is a set of exercises that you have to do before breakfast, lunch, dinner, and bed. Takes about 15 to 20 minutes each time. You'll need coaching. You'll need to learn how to do breath holding in a proper way so that you can recondition your respiratory center. And people who are able to do that find their control pauses improve, their maximum pauses improve, the symptoms begin to diminish, and that's the idea behind the Buteyko method. Some people, usually children, find it very easy, very straightforward, and those of us who are older find it more difficult. But still, regardless of the difficulty, it's worth it, at least in my opinion, because what's the alternative? To succumb to you know, the symptoms and medications which don't solve the underlying problem, and one way or the other you end up worse for it. So on that happy note, I'll thank you again for your very kind attention, and I'm hopeful that some of you will be in touch with us in case you're interested in this work, whether you want to do it privately or you want to do it in a group course online. And I think that's it. Thank you very much. Good night. Am I off?